Om Swastiastu. Hello everyone, my name is Huliana Lim and I'm the representative of Student Group Discussion B8 Udayana Medical School. In this occasion, we will going to present our student project of this blog with the given topic food allergy. And this is the members of Student Group Discussion B8. And now we will going to start the presentation with the explanation of the background of the student project. Thank you.
Hello, my name is Azza Alfadhila with 3-digit student ID number 094. I will explain the background of food allergy. Food allergy is a hypersensitivity response mediated by immune system after consuming certain foods. More than 170 types of food have been identified that can cause food allergy, and most of these foods come from fish, shellfish, peanuts, milk, tree nuts, soybeans, wheat, and seeds and eggs. Food allergy can be classified into two groups, namely IgE-mediated and non-IgE-mediated allergy. IgE-mediated allergy usually has a rapid onset and clinical symptoms develop from minutes to hours. Meanwhile, non-IgE-mediated allergy usually have severe and chronic symptoms. In the epidemiology aspect, the prevalence of food allergy in Indonesia is at range 5 until 11%. Symptoms in patients with food allergy are non-specific and difficult to establish, so the diagnosis process is quite challenging. However, the most common symptoms of IgE-mediated allergy is a cutaneous manifestation such as rash and urticaria or angioedema. In addition, other symptoms that can cause food allergy generally involve the gastrointestinal system when food is discussed, such as pain, nausea, vomiting, and diarrhea. Until now, management of food allergy has been limited to the treatment of anaphylaxis and symptom management using antihistamine, corticosteroids, and bronchodilators. However, management of food allergy tends to be expensive and not cost-effective. With the increasing of prevalence, serious impact, and symptoms that are difficult to distinguish, further and better understanding of food allergy will be very useful, especially for medical students, doctors, and other health workers in recognizing and managing food allergy properly. From that background, several formulations of the problem were obtained, including the first one, what is the general description of food allergy? Second one, what is the classification, etiology, and pathophysiology of food allergy? And the next, what are the clinical manifestations of food allergy? How to diagnose and what is the differential diagnosis of food allergy? How is the treatment or management available for patients with food allergy? The sixth one, what complication can occur in patients with food allergy? And the last one, what is the prognosis for patients with food allergy? That's all from me. Thank you.
Okay, hello everyone. My name is Ugrasena. My digit number is 20251184. So today I'm going to talk about objective. So the first one is to know the general description of food allergy. Second one is to understand the classification, etiology, and pathophysiology of food allergy. To know the clinical manifestation of food allergy. To know how to diagnose and different diagnoses of food allergy, to find out the right treatment and management available for food allergy sufferer, and to find out the complication that can occur in patient with food allergy, to know the prognosis for patient with food allergy as well. So this is the benefit. So the benefit of this student project for us as a medical student include complete knowledge of food allergy, starting from its etiology, epidemiology, pathophysiology, clinical manifestation, diagnosis, different diagnosis, prognosis as well, to find out the right treatment and its complication. The benefit of this scientific learning is that we can learn more about food allergy and know how to treat it. The benefit for the community included increasing knowledge in the community, gave a better understanding of food allergy and appropriate prevention and management for it.
My name is Luh Wina Saraswati with the last 3 digits of student ID number 142. Now I will continue to explain chapter 2 content in the first part overview. Food allergy is defined as an adverse immune response or reaction to a particular food antigen that is harmless to a healthy population of humans that can be mediated by immunological mechanism and usually occurs in individuals who are susceptible to a particular allergen. Food allergy is the most common condition in immune disorder. Immunoglobulin E is the antibody most frequently involved in mediating immune response to food, where antibodies bind to mast cells and basophil. Now I will explain about the classification. In general, food allergies can be categorized into two: IgE-mediated and non-IgE-mediated. IgE-mediated food allergic reactions have a rapid onset with clinical symptoms appearing within minutes to hours after ingestion of this food. Symptoms may be present and localized. Some examples of disease are anaphylaxis, urticaria, angioedema, oral allergy syndrome, acute rhinitis, and acute asthma. In contrast to IgE-mediated food allergic reaction, diseases caused by non-IgE-mediated food allergies are usually chronic and may be difficult to control with food avoidance alone. Some examples of disease are contact dermatitis, dermatitis herpetiformis, protocolitis, celiac disease, and others. That's all from me. The presentation will be continued by my colleagues. Thank you.
Good morning, Dr. and friends. My name is Felix. With last stage of student ID 099, I will continue the presentation regarding the food allergy. So, food allergy is the most common type of immune disorder which caused by certain type of food protein known as the allergen. The food allergen are usually hydrosoluble glycoprotein which are easily transferred across the mucosal surface in the intestines, and it is hard to break down. There are more than 170 types of food known to be the cause of food allergy. However, the most common types are peanuts, shellfish, soybeans, egg, fish, milk, wheat, and tree nuts, and many other types of food which contain these type of ingredients. So there are some pre-existing conditions are associated with food allergy, such as asthma, age, atopy, ethnicity, gender, genetics, and vitamin B insufficiency. So next, regarding the epidemiology of allergy are the most common type of health problem around the world. The prevalence of food allergy is known to be increasing over 10 until 20 years. However, there are some data that show a different type of result. The prevalence of food allergy around each country is really randomized because it's shown that how important is the environmental factor in influencing the prevalence. So the most common type of food allergy in the Western world are the IgE-mediated food allergy. The prevalence in children below 3 years, which are 6 until 8%, which estimated they has 2.4 children has multiple food allergies, and 3% of them has experienced a severe reaction. So that's all for me. Next.
Hello everyone, my name is Angelyne from Mulia with last digit number 051. So next I will explain about the pathophysiology of food allergy. Food allergy can be categorized into two groups, namely IgE-mediated and non-IgE-mediated. But the most common food allergy comes from the IgE-mediated group. IgE-mediated food allergy is the result of a loss of integrity in the main component of the immune system that maintains a state of tolerance and prevents food antigens from being recognized as pathogens. The symptoms occurs because there is immune suppression of eosinophils, basophils, mast cells, and effector cells, which happens as a result of differentiation of naive T cells into T regulatory cells and suppression of food-specific antigen T helper 2 cells, increase of IgA and IgG4 production, and decrease in IgE by B cells that caused by oral tolerance to foods. Sensitizations can be a precursor because it is defined as the condition of having detectable food-specific IgE throughout the phase of allergic sensitization. When the first contact with allergen occurs, it determines an initial immunological response which leads to breaking of tolerance and followed by the production of specific IgE. Once IgE is produced, it will bind to the high affinity receptor for the Fc fragment on the membrane tissue of muscles and circulating basophils, which contains vasoactive substances and mediators of anaphylaxis such as histamine. Therefore, these cells become sensitized, and when there is second contact with the allergen, they will activate and degranulate, then releasing the anaphylactic mediators in the tissues and blood flow. After the effector cells degranulation, the de novo production or synthesis of new molecular complex of other immunological mediators also occurs, such as platelet activation factor, leukotrienes, and cytokines, including interleukin 4, 5, and 13, which jointly contribute to the allergic inflammations.
Good afternoon, doctor. I'm Annisa Nuraini with the last 3 digits 110. I would like to continue the presentation on clinical manifestation of food allergy, which can vary from patient to patient. Manifestation could range as a mild and localized case of hypersensitivity or systemic and fatal case like anaphylactic shock. It can affect several different organs and systems. The GI tract. The main clinical manifestation include the oral allergic syndrome and GI hypersensitivity. The most common manifestation is acute vomiting. Other symptoms such as constipation, bloody diarrhea, and emesis are considered manifestation of non-IgE mediated food allergy. Commonly affected by food allergy is skin. Its clinical manifestation varies from non-IgE mediated reactions indicated by the contact and herpetiformis dermatitis, IgE mediated reactions indicated by angioedema, flush, and mixed IgE and non-IgE mediated reactions indicated by atopic dermatitis. Lastly, anaphylaxis is a rapid, potentially fatal allergic reaction that involves multiple systems. This reaction could be IgE mediated or caused by other immunological or non-immunological mechanisms. Rarely, anaphylaxis can also occur with only cardiovascular or neurological symptoms like unconsciousness, weakness, even cardiovascular collapse. That is all from me. Thank you.
Hello everyone, my name is Gloria Grace Melanita Sihite with the last 3-digit number 162, and I'm going to explain the diagnosis of food allergy. So the first line approach is to do anamnesis, where we can obtain the patient's clinical history. We can also conduct a physical examination to observe the clinical manifestations shown, seek the possible allergens, previous diets which affect the symptoms, and more. If a diagnostic test is needed, then skin prick test, serum-specific immunoglobulin E test, and oral food challenge are available. However, oral food challenge is only performed if skin prick test and serum-specific immunoglobulins E test result is equivocal, because even though it is the gold standard, risk of severe reaction such as anaphylaxis might occur due to the oral food challenge. It also needs to be carried out by experienced physicians. The weakness of the skin prick test and serum-specific immunoglobulins E test is these tests are related to a high rate of false positives and also only indicate allergen sensitization. Therefore, it is essential to collect accurate clinical history. But nowadays, the new diagnostic tests that have been developed are component resolve diagnostic, CRD testing, and basophil activation test, or BAT. That's all from me. The presentation will be continued by my friend. Thank you.
My name is Gede Samudra, number 023. Now I will explain you about differential diagnosis. First one is anaphylaxis. Anaphylaxis is a rapid allergic reaction and can lead to death. Anaphylaxis can be caused by either IgE-mediated or non-IgE-mediated mechanisms. The diagnosis of chronic anaphylaxis depends on the reliability of serum tryptase level and has to be assessed through an accurate methodology. Second one is angioedema. Food allergy reactions hardly become severe and most often associated with symptoms such as dyspnea, hypertension, functional dyspepsia, and urticaria, as well as angioedema. Angioedema happens when capillaries leak fluid into the organ tissues and therefore contributes completely to swelling. Allergy tests are useful for screening this, but noted that food allergy is an uncommon cause for angioedema. Third one is carcinoid. Patients with a carcinoid syndrome are often misdiagnosed with other diseases, such as food allergies, IBS, and diverticular diseases when presenting with abdominal pain and diarrhea. These patients better to lessen the consumption of amines or thyramines containing foods, such as chocolate, in order to decrease symptoms of carcinoid. That's all from me. Thank you.
Hello everybody, in this opportunity, I would like to explain the treatment of food allergy. First of all, let me introduce myself. My name is Putu Artika and my student identification number is 20025111084. So let's start it. Currently, there is no cure for food allergy. The current recommended treatment includes strict avoidance of the food, education for recognition of an allergic reaction, and providing management plans in cases of accidental exposure and allergic reaction. Patients need to be instructed to read food labels, be attentive and diligent when eating out or eating prepared foods, and be careful about cross-contact of allergenic foods in buffet or during meal preparations. Epinephrine is the only proved treatment of anaphylaxis, and for these reasons, patients should always carry self-injected epinephrine because accidental exposures can occur anywhere, even in the home. Steroids and antihistamines may help as well, but are second line to epinephrine. Patients and families should be instructed on the use of self-injected epinephrine, and this should be demonstrated in the office with a training device. Okay, that's all my explanation about the treatment of food allergy. This presentation will be continued with my other friends. Thank you.
Thank you for the opportunity given to me. So now I would like to introduce myself. My name is Krishna Putra Pramanda. My name 128. So now I would like to continue this presentation about the complication of food allergy. As we know, food allergies come in variety of complications, including anaphylaxis, respiratory distress, and cardiac arrest. First, anaphylaxis. A severe allergic reaction known as anaphylaxis can be triggered by food allergy in certain people. This can result in life-threatening symptom and indication. Anaphylaxis, if left untreated, can result in coma or even death. Anaphylaxis is a severe and sometimes fatal allergic reaction that develops quickly and may result in death. The second one is respiratory distress. Food allergies can affect both the upper and lower respiratory passage, and food allergy alone common in infants or food allergy combined with another defects such as an immunodeficiency syndrome such as isolated IgA and IgG4 deficiency, a congenital defect of the heart or tracheobronchial tree, gastroesophageal reflux, or a concomitant inhalant allergy can cause symptoms in either. The most prevalent respiratory manifestation of food allergy is chronic wheeze. It may be useful sign of activity of the allergic lungs illness and the patient's compliance with a specific diet when it occurs in conjunction with lung disease. The last one is cardiac arrest. The majority of clinical symptoms and possibly fatal consequences are caused by cardiovascular system. Chemical mediators generated during allergic reaction are both a source and a target for the heart. Muscle can be found in abundance in the human heart to minor intramural capillaries. Various stimuli such as allergens, complement factors, general anesthetic, and muscle relaxants can activate cardiac muscles. That's all from me. This presentation will be continued by my friend. Thank you.
Hello everyone, my name is Natasya Pusparani with a 3-digit number of 227, and here I'll be explaining about the prognosis of food allergies. So in most cases of food allergies, the prognosis is often good. However, it may increase the risk of having an atopic disease. That is why it's important to monitor for other allergies. As time passes, food allergies during childhood may be tolerated, especially on eggs, milk, wheat, and soy. On the contrary, allergies for nuts and shellfish would be more long-lasting. By school age, approximately 20% of children would have resolved their food allergies. Food allergies not caused by IgE would be resolved within the first year of life. So, however, in some cases, there is still a possibility for anaphylactic shocks to happen. For those with food allergens of milk or egg, it is recommended to ingest these products in forms of baked goods containing those ingredients. Some may be able to tolerate it, but there are some that may still experience anaphylaxis consuming these two ingredients even in baked one. However, if the person is tolerant, it is deeply encouraged to regularly consume them. It is important to conduct reevaluation annually for food allergens, especially for children in their childhood. This can be done with the help of clinical history of one's allergies or serum food-specific measurement of IgE, and sometimes both can be used. This also serves as a good opportunity to note one's allergies and how to manage anaphylaxis if it does occur. Next.
Thank you. Hello everyone, my name is Huliana Lim. My student ID number is 2002511080. Okay, now I will go into clarify the conclusion of the student project. Basically, food allergy is a hypersensitivity response mediated by the immune system in response to the consumption of certain food. Certain food proteins will be recognized as allergen by the immune system, resulting immune response that can cause a variety of allergies. Food allergies can be caused by more than 170 different foods, including seafood, peanuts, and milk as the common causes of food allergy. The most common type of food allergy is IgE-mediated food allergy. Symptoms: occur as a result of immune suppression caused by oral tolerance of food. Common symptoms of IgE-mediated food allergy is cutaneous manifestations such as rash and urticaria or angioedema. Other symptoms that can be caused generally involve the GI system, such as abdominal pain, nausea, vomiting, and diarrhea. To diagnose food allergy, we do obtaining a clinical history and conducting a physical examination. That we can also use the diagnostic tests such as skin prick test, serum-specific IgE, and oral food challenge. Food allergy can cause severe immune system reactions such as anaphylaxis, respiratory distress, and cardiac arrest. For the treatment, food allergies should be treated with the emergency medications such as epinephrine and antihistamine. The most important thing is to evaluate annually and avoid the food allergy stimulus. Okay, I think that's it for the conclusion. Next, the source of the bibliography of this student project. You can see in the link down here, or you can scan the QR code in front of you. I think that's all for our presentation. Thank you for your attention. Sorry if we had many mistakes. Santi.